Hypertension or high blood pressure silently affects 1.2 billion would-be people in the world. It's a global health challenge that knows no border, impacting lives from every corner of the globe. New medical trends are reshaping how we manage this silent killer, from cutting-edge digital health wearables that monitor blood pressure in real time to precision medicine, targeting treatment based on your unique genetic makeup. Among these exciting advancements are the SGLT inhibitors, initially designed for diabetes. SGLT inhibitors are now proving effective in lowering blood pressure, offering hopes to millions of people worldwide. Even the queen of rock and roll, Tina Turner, has faced this condition, reminding us that hypertension can affect everyone, regardless of status or success.
I'm Christina Bear. Welcome to today's Business Minute.
Emerging biotech hedge fund Evergrowth BioHealthcare Capital. We invest mainly in young growth biotech company that have their lead drug in the preclinical stage or early product stage because they have much more growth potential. There are new gene therapy being approved, gene editing drug, and then also innovative drugs to treat obesity, to treat diabetes, to treat liver condition, and also many novel or new drugs to treat cancer. Now, by investing in companies that are at the forefront of such innovation, we support the cause that will continue to deliver the hope and new drug and new technology that ultimately improve the quality of life for the patient.
In our binary event forecasting strategy, we have a very high success rate, over 80% success rate. And by using that, we get able to position out properly and take advantage of those opportunities.
Within 6 months, we have over 40% return. So in the coming year, there's a chance of even grow up to multiple fold in a very short time.
Welcome to our Open Mic webinar for this week. We have the honor of having Dr. Van Nguyen, who is chairman of our Medical and Scientific Advisory Committee, to do the presentation for us. And topic for this week is on the diagnosis and management trend for hypertension or high blood pressure. Hypertension is considered as the silent killer. 1.2 billion people worldwide are affected by it, and deadly nature of hypertension or high blood pressure is often asymptomatic. You might have high blood pressure and you do not know about it, but left untreated, high blood pressure can significantly shorten your lifespan. So make sure you watch this video to get more information on it, to learn more about it, so that you can talk to your doctor and start the treatment plan to manage your hypertension, to treat it, to cure it, so that way you can live longer, healthier, and also with more energy. Enjoy the presentation.
As you can see, we have a normal heart with no high blood pressure. So with that, the heart pumps normally and the blood flow easily. However, when hypertension has been occurred, the heart have to pump much harder and the blood flow might not flow easily. Definition of hypertension is a condition where the force of blood against the arterial walls is too high, typically defined as anything above 130 systolic number and 80 for the diastolic number. Etiology, we have multiple etiologies that can cause hypertension. Pressure is really multiple reasons result of what we label as essential or primary hypertension. So there's too many causes to make a diagnosis of just one cause. So it can be work stress, it can be genetic, it can be increased salt intake, it can be trauma or stress of a person's life in recently can result in high blood pressure to occur. Secondary hypertension is caused by underlying medical condition. It can be from kidney condition, or can be a tumor, or can be from artery stenosis, or can be hormonal disorders. As you can see, high blood pressure is being defined as systolic number when the heart is contract, when the pressure is above 130 millimeter of mercury, or when the heart rests, which is the diastolic number, when the number should be less than 80 millimeter of mercury. The stage in high blood pressure as being labeled here, elevated, is when systolic number is above 120, but lower than 129 millimeter mercury for the systolic number. Patient would reach stage 1 of hypertension when systolic blood pressure is above 130 millimeter mercury, but less than 139, whereas diastolic number would be above 80 millimeter mercury, but less than 89. The stage 2 hypertension is when systolic blood pressure is above 140 and diastolic blood pressure above 90. Patient would be labeled as hypertensive crisis if their systolic blood pressure is above 180 millimeter mercury and the diastolic blood pressure is above 120 millimeter mercury. Effects on the body. A lot of time we see patients come to the ER with symptoms, and we look at their blood pressure after measurements and found that they markedly elevated, but they also have symptoms. Then we would label them as hypertensive emergency, because we found that when they have symptoms, they also have end organ damage, such as you see here. You can have cardiovascular damage, put you at increased risk of heart attack, stroke, or heart failure. Kidney damage, which can lead to chronic kidney conditions. And then you have vascular effect, which affect the eyes, the cerebral and peripheral arteries. The global impact of hypertension, over 1.3 billion people worldwide. About 1.25 of those billion people are adults over age 30. However, the small subset of population, less than half a billion, can also be children or young teenagers or young adults. Often, high blood pressure have no symptoms, but some cases we can have symptoms as displayed here: headaches, dizziness, chest pain, palpitation, shortness of breath, nausea, vomiting. Usually, the symptoms occur when the blood pressure becomes markedly elevated. Signs of high blood pressure, basically elevated blood pressure measurements. Sometimes we can see them on retinal exam when we do physical exam for the patient. But we can also see left ventricular hypertrophy on exam and EKG and echocardiogram when we do further testing on the patient. Condition that would improve blood pressure, as we mentioned earlier, there are several conditions that can help lower blood pressure down with lifestyle changes. Number one, physical activity, weight loss, reduce in coffee consumption. I recommend to my patient no more than 2 cups of coffee a day. Eat healthy diet. I usually recommend Mediterranean, no processed foods. And then medication can also cause high blood pressure. Diagnosis is by blood pressure measurement. We do multiple readings over a period of time. We also have ability to do ambulatory blood pressure monitoring. We give them an overnight device to check their blood pressure. Of course, we also look at labs and looking for secondary causes from the high blood pressure. Treatment, as we mentioned earlier, lifestyle modification will be very important to proceed, but we have multiple medications available for treatment. The main reason to treat high blood pressure with medication is to reduce the constriction of the blood vessel. So we use vasodilators, but the high blood pressure also can occur from increased heart rate. So someone who have elevated heart rate will also want to consider using medication that will lower blood pressure down, such as beta blocker and calcium channel blocker. And then of course, we also use medication such as diuretic to remove the salt, the sodium in their body. And with that, the water also follow as well. New medical trends, the wearable device is a great option for many of our patients. As you know, the smartwatch now can monitor the blood pressure and allow patients to be alarmed if they have elevated blood pressure. We also now have precision medicine based on genetic profile. We can determine who can respond to beta blocker, who can respond to calcium channel blocker. Ways to improve, as I mentioned before, telehealth also has been significantly improved in healthcare delivery, allow more awareness of high blood pressure, and biotech research also focus on novel drug targets. New therapy allow us to improve blood pressure control. The new medications that the forefront that a lot of news have been about is for the SGLT2 inhibitors that help with weight loss. But we also see that they are very effective in lower blood sugar and now also lower blood pressure, and has improved the heart failure, the chronic kidney disease endpoints as well.
Also, there's an alarming trend among young people. Specifically, research showed that there are more young people nowadays that are having high blood pressure or hypertension. Back in the days, that's not the case, but nowadays, just because you think that you are young, you are healthy, but you can think again, you might still be having hypertension or high blood pressure. And that's due to a combination of different factors, a combination of alcohol abuse, smoking, obesity, sedentary lifestyle, all contribute to more young people nowadays having high blood pressure or hypertension. As a result, it's very important that you, through this video, get more information about it and then talk to your doctor to make sure that you get your diagnosis and then prompt treatment. So that way you can avoid the deadly consequences of this silent killer, hypertension. If you want to capture this lucrative opportunity while investing in the innovation that deliver hope to the patient, but you either don't have time or you don't have the expertise, reach out to us, contact us. We'll schedule a call to see if we are the right fit for each other.